and he believed that there was something that probably caused this systemically.
I was very concerned when he first spoke of an autoimmune disease because I know that they could be very dangerous.
The physician suspects Teresa has lupus, a serious inflammatory disease that can attack all the organs of the body.
The doctor ordered a workup of my blood.
The wait felt like forever.
I'm thinking, well, now do I have an autoimmune disease that's going to completely change my life? The thought was absolutely devastating to me. I was terrified.
Over the past year, Teresa Racklin has been experiencing frightening distortions in her eyesight that no doctor can explain. But now, one expert suspects he knows what's triggering her bizarre symptoms. Lupus, an extremely debilitating and often fatal autoimmune disease.
I was scared. I wasn't sure how it was going to impact my life.
Finally, after 3 excruciating days, the findings are in.
When we went to the hematologist, he said that they didn't find anything wrong.
I was really happy to find out that all my blood work came back normal, but I was frustrated not still having an answer.
Over the next month, doctors lead Teresa through a series of specialized autoimmune tests, but everything they run comes up empty.
I didn't know what else to do. On a daily basis, I would have cotton wool spots in my vision. I thought a lot of Ashley because maybe I was sick with some sort of a disease and that I wouldn't be around for her.
Worried and confused, Teresa does the best she can to get through each day. Then, while at work in December, she's blindsided by a frightening new symptom.
I noticed that I got this strange sensation in my ears that was like a loud pitch noise that had just come out of nowhere. Everything started to feel weird. I developed dizziness that was strange. I felt like I was falling to the left, like I was on a boat.
We had no idea where this vertigo was coming from or the ringing in our ears. It was very, very upsetting.
Teresa returns home, hoping the dizziness and ringing sounds are just temporary. But over the next few weeks, the strange symptoms recur again and again.
It was a battle every day just to maintain a normal lifestyle. And there was this screaming in my ears. It made my head a crazy place. I felt completely alone.
While Teresa tries her best to get through each day, even simple activities become impossible.
We went to my grandmother's house for Christmas, and when we sat down, I felt like I couldn't hear right, and I wasn't balancing right, and I kind of felt like I was in my own world. I was really upset. My life was falling apart in front of me, and there was nothing I can do about it. Then I started developing really strange heart palpitations that were really scaring me. They were taking my breath away. I said, I need to get to a doctor right now.
Terrified, Teresa schedules an emergency appointment with a local cardiologist.
The doctor did a thorough exam. I told him about the cotton wool spots in the eyes, and he was familiar with them. And he said that it would be a good idea to determine if I had a positive PFO in my heart. PFO is a hole in the heart that we're all born with that's supposed to close up by the time you're about 2 years old. And in a significant number of people, it doesn't close up entirely, and it can cause problems. I was scared at the thought of possibly having to have heart surgery, but I thought, I'm at the end of the road. I'm going to find what's causing this, and we can fix it. The doctor did an echocardiogram with a bubble study. If the test was positive, then The bubbles pass through from one side to the other.
Moments later, the monitor shows dozens of tiny bubbles passing through one side of Teresa's heart to the other.
The doctor said I had a PFO that was so tiny that it wasn't going to cause me any problems. I was more frustrated than relieved. Not that I wanted to have heart surgery, but I wanted an answer. The doctor thought it was all related to the stress and anxiety, and they told me to just go home and relax.
Determined to get to the bottom of her puzzling situation, Teresa consults one doctor after another.
No one could give me answers. I started to question my sanity and thought, is this more in my head than reality?
There were eye doctors, retina doctors, rheumatologists, hematologists, you name it, she was going to them. I thought, won't anyone help my daughter? I thought a break would help her.
I left my job. I didn't know what each day held for me, and I just became afraid of everything.
Teresa was afraid to leave the house with Ashley because she didn't know if she was going to have another episode or partially go blind or lose her hearing. It was really hard for me at times.
The situation became really emotionally exhausting. He was getting really tired of trying to be the strong one all the time while I was completely falling apart. There were days that I would wish that he would just leave me so that he could go and have a good life.
It was very hard, but I married her for better or worse in sickness and in health.
As bad as things are, Teresa can't imagine the terrifying turn her life is about to take.
It was a beautiful Sunday morning, and the sun came through all the blinds and blinded me for a minute. It looked like somebody had taken white paint to the top right part of my vision in my right eye. I started to really panic. The only thing I could think was, I'm going blind. I'm losing my vision, and I'm never going to see my child again. I was very scared, so I called the eye doctor right away. And he said, I would like for you to come in and see Dr. Tiedemann, who's our retina doctor. When I had arrived, my vision had improved, and we sat down, and he wanted to know exactly what all of my symptoms were.
And as a physician, one of my main goals is to tie together things that may not seem to be related, but often really are. I had been fortunate enough to see other patients who have had this constellation of symptoms.
Now, Dr. James Tiedemann thinks he knows what's going on and has referred her to neurologist John Susac to confirm his hunch.
When I arrived to see Dr. Susac at his office, he performed a variety of eye tests.
In 1975, I discovered a disorder, and her symptoms fit entirely with that condition. Her symptoms led me to make the diagnosis of Susac syndrome.
Susac syndrome is an extremely rare disorder that affects the retina, ear, and in some cases, the brain. In healthy individuals, blood vessels transport blood and the oxygen it carries throughout the body. But in patients like Teresa, for some unknown reason, the immune system goes haywire. It attacks the walls of the blood vessels, causing inflammation and inhibiting blood flow.
And when these small blood vessels swell, there is not enough blood that gets to the brain, retina, and inner ear, and they cannot function normally.
I was very thankful to hear that there was a name behind what was actually happening to me.
While there's no medical explanation for why or when the disease strikes, it's clear that all of Teresa's symptoms stem from the blocked blood vessels, starting with her ocular migraines.
Ocular migraine seems to be caused by spasm of blood vessels. When the blood flow is interrupted, it's only a matter of a few seconds before the retina stops functioning. Vision loss is very nearly immediate.
And as Teresa's disease progressed, more and more tiny blood vessels in her eyes were affected.
Each part of the retina has a blood flow that is uniquely served by just one branch of an artery. And when a tiny branch of the artery is blocked, it's a tiny defect in vision in the area that's served by that blood vessel.
Eventually, the blood vessels leading to Teresa's inner ears became constricted too, causing vertigo and ringing sounds.
He explained that the fine vessels that bring the blood to my ears would spontaneously close up and cut off the blood flow.
Susac syndrome can have a very wide range of severity. It can be very disabling, and it can cause complete hearing loss, profound vision loss, and other symptoms within the brain.
But while the doctors are confident that Teresa has a mild form of the disease, she's not out of the woods yet.
We ordered an MRI in Teresa because in many of these patients, even though they have the limited form of the disease, they can have abnormalities in the corpus callosum, a certain portion of the brain.
Teresa thought that she was going to die. She was afraid that she could be bleeding in her brain.
I just dreaded waiting for the results. I was scared that something was going to happen to me and that I wasn't going to be around to raise my daughter.
If Teresa had something wrong with her brain from this illness, I thought she would not live very long. And it scared me to death.
When Dr. Susac told me that my MRI was normal, it was just a huge relief.
Monitoring Teresa in the future will help guide us in terms of what might be the most helpful to her if there are changes in her condition.
It's clear now that for both medical and psychological reasons, Teresa is extremely lucky to have landed a diagnosis when she did.
If I went undiagnosed, I'm not quite sure what would have happened to me. It was such a huge relief to know that I actually had something. All my symptoms were very real.
We still had questions about the future and what it was going to bring.
While there is no cure for Susac syndrome, there is treatment available. For Teresa, we recommended steroids, an immunosuppressant, and IVIG.
But the treatments can be risky. Steroids can lead to osteoporosis, and immunosuppressants leave the body defenseless against infection.
I was concerned with the treatment because I was worried that the side effects would be actually worse than the symptoms she was having.
I chose not to start the treatment yet. If my symptoms get worse, then I will start the treatment.
The good news is, for reasons doctors don't understand, after 8 to 10 years, patients with the syndrome often spontaneously go into remission.
He said that I had a really good prognosis, and he feels there's a chance that I could be in remission without any sort of treatment.
With a solid diagnosis finally in hand, Dan and Teresa can't help but wonder why so many doctors failed to put the pieces of the puzzle together.
Susac syndrome is very rare. There's no laboratory test that you can draw to get a diagnosis. There have now been well over 200 cases of Susac syndrome reported in the world's literature, and that only represents the tip of the iceberg.
Today, almost 2.5 years since the disease set in, Teresa is meeting the challenges of her condition with new confidence and peace of mind.
Teresa still struggles with her disease, but she's able to handle it a lot better. Her attitude has changed a lot. She's become a lot more positive. She's a lot more outgoing.
I am definitely more independent than I've been in years now. I'm starting to go out with my daughter and do things that I have never done with her. And my husband and I are very, very strong.
We're a lot more active now. We take Ashley to the park as often as we can, and we do just whatever we can to get out and be a happy family.
I used to take my vision for granted. I didn't know any better. And now there isn't one day or moment that I take my vision for granted. And I'm so thankful every day that I can see my daughter.